Hello, my name is Leonardo Muller Rodriguez, and I'm here with Niobis Queiro, the CEO and founder of the Cairo Group, who focuses on healthcare administration, revenue, and innovation. Now, a lot of people know that healthcare administration is actually quite slow, bureaucratic, and complex. Do you have solutions, AI solutions, non-AI solutions for this purpose in healthcare administration?
Absolutely. So here's the thing. In America, it is extremely complex. We have over 2,000 different ways of getting paid for the services that we provide. It's bureaucratic and just simply insane. Innovation has been the true change agent in the mix. Bringing AI into the forum has taken all the duplicity and all the bureaucratic movement basically out of the work. Right. However, our problem is not everybody can afford it. Right. And there are a lot of providers that just can't afford to do it. So what my company does is we help the providers have the strategy so that they can take the fat out of their business by using technology and gain the reimbursement that they deserve. Right.
So you help healthcare companies to be able to provide the care, simplify the costs. Mm-hmm. And do you see, therefore, more treatments that is being carried out in the healthcare companies that you're working with?
So one of the main focuses is to deliver access to care to the patients. Mm-hmm. So one of the areas that we're focusing heavily on is rural care in America. 20% of Americans live in rural environments. And even though there's a greater need for care, mm-hmm. there isn't any care available. So bringing technology and AI into it, it takes the care into their space, even though maybe there's not a doctor in their town, but now they can use AI to have that specialist be a telehealth event.
All right.
There's a means of using electronic systems to get diagnostics done in a very different way than we were able to do it before.
I see.
So, and what we do is we really work on that access proposition, but we also work on the brain and understanding that as a leader, as someone that is getting care, that you have to change the way you think about it so that you can adopt the new technology. So we do leadership architecture mm-hmm. so that we can understand the human-centered nature of AI and also how technology is an enabler mm-hmm. instead of a disruptor.
Great. Yeah. Still keep that human aspect, which is crucial in healthcare and treatments, but still improve the access for people who don't have as much access in rural areas or maybe poorer situations.
Yeah. Urban areas is the same issue. Mm-hmm. The reality is there's not enough care for the need. Mm. So we have to be creative on how we deliver that to the patients. But more importantly, we have to be creative about how we can create quality outcomes by using technology, by having the human be the center of how to create it so that they can adopt their new healthcare. And the doctors aren't burnt out. Mm-hmm. They can actually do their dream, their purpose, fully engaged because they are being enabled to do more without having to burn themselves out.
Fantastic. And tell me, why did you start the Cairo Group? What inspired you? Is it a personal journey? Did you want to help someone in specific or just in general solving a societal problem?
It is 100% a personal journey.
Right. Tell me about it.
In 2021, I woke up on the floor of my bathroom having crashed through the glass of the shower. Wow. And I was bleeding everywhere and I didn't know what was going on. My husband called 911 and we find out that I was septic. Okay. My whole body was dying.
Tell me about that.
What that means was that I had full organ failure. All my organs had shut down and I had a cardiac arrest. So my heart stopped. They were able to bring it back. They took me into surgery, and it happened again.
Like how long afterwards?
An hour after, I lost everything. And I came back. And this time, they put me in this machine called an ECMO machine. And that takes all the blood out of your body and oxygenates it and brings it back. And I was doing that over and over again for 24 hours before I had my surgery. I became the patient, where all my life I was just administrating how care was delivered.
I see.
And I realized all the aspects of care. I realized the pain of being a patient and all of a sudden you don't know what's next. I realized how the doctors are working endlessly to provide care and sometimes they fail. I went through so much that I knew that I had to start following my purpose, and that was to give back, to make access to care better, to use technology that I knew and I was an expert in a different way.
Mm-hmm.
And that was my open door. You know, when I had my cardiac arrest, I also had an out-of-body experience. And I remember asking my higher power, why? And the answer was, because you're not done. Well, I'm not done.
What a powerful experience. What a story. That's very powerful. And I mean, from there you decided to build your company, go out and change the healthcare administration. Already you were in that industry.
Yes.
And I mean, how did you start? Did you need capital? Did you need people? Did you need skills? Were you already in that? And what would you give yourself as advice now that you have the experience to when you first started?
The number one advice is don't believe, you have to go for it. And if you ask, people will help. I think the hardest things of a lot of entrepreneurs is the fear to ask for help. Mm-hmm. And the legacy of what you've built will propel you to your success because people trust you and they know that you do good work and they will give you a chance. And when you first start, I think you really think you're an imposter. And I had to move away from that. In fact, that's going to be my talk with LOSD.
All right.
About how you need to understand your full self and be your self architecture of your leadership and how you do business. Now, fantastic. I was very lucky. I had enough savings. I gave myself the belief that I needed to have a year's worth of salary in the bank in order to start the business, and I did. I also spent 6 months before I started the business building the business. So I was working in my primary business, which I was the senior vice president of revenue for Tufts Medicine in Boston.
Right.
And during that time, I knew that I had to, number one, start marketing myself. So I was speaking at every conference you could think of. I started building my social media accounts. And I started getting clients, just micro work, little consulting here, consulting there. But by the time I went and I knocked on the door and said to my boss, I'm ready to leave, I already had 3 clients in the pocket.
I see. Yeah.
So I was not starting and sitting home saying, okay, what's next? I have a shingle. What do I do now? I already had set the stage. And I say to people, plan ahead. Understand it's going to be hard and understand it's going to be lonely.
Yeah.
There's nothing, the toughest thing about being an entrepreneur is cheering yourself on to do something every single day.
So tell me about those challenges. What was one lesson that you've learned from a difficult moment with your entrepreneurial journey?
The waiting was painful. Sales periods are long, especially in healthcare. In healthcare, you could do a pitch, and it could take up to 6-7 months before that pitch is signed.
I see.
Because even when you get the LOI, then the lawyers keep it in tow for another 4 months. And you
Check it or
oh yeah, checking, and they're asking for this information, that information, and because I do innovation, they're asking for certifications. They're checking your certifications. So by the time you get through all that paperwork, 6 months have passed before you got to the client, before you got to the work, and then the work changes. So patience was the toughest thing, and like I said, every single day, do something towards your business. Even when things aren't moving, you must be moving.
I see.
And the last thing is believe. Believe in yourself. That's number one. Your core has to be real. Every entrepreneur is a delusional person that believes in their product, in themselves, beyond the success.
Sure.
The success will come,
Yeah.
but you better be delusional and believe in it before it comes.
Of course, you're building it, you're creating it. It doesn't exist yet.
It doesn't exist.
Believe it, yeah.
So, I live with I actually have a sign in my office that says, I am a little delulu.
Fantastic. So let's focus on the fulfillments that you've experienced. What have been things that you've felt that were very fulfilling, whether it was working with people, communities, or lives that you've changed through your company?
One of my favorite projects that I was able to fulfill was with Nashville General Hospital, which is an underserved community in Tennessee. And I was their strategist for their innovation in their organization and helped them build their physician organization. We were able to create services in an area that there were no services. So we brought clinics, and just seeing the happy faces that now they didn't have to go out of their way, sometimes walking. Some of these people don't have bus money.
Right.
But we extended our services to have buses pick them up.
No way.
Yes.
Wow.
We also were able to create new clinics in environments that were deserts. So that was, to me, the most special because it was human impactful.
Wow.
It wasn't about my old life, which was just finance. Now I was really working with the people and creating change.
That's amazing.
Yeah.
Wow, that's such an amazing expansion into the urban setting, the societal, not just the actual clinic,
Exactly.
Which is also important to give access to. So quick fire, I'm going to give you 4 options and you're going to tell me which is the priority for your growth in the future. Is it scaling the business? Is it improving access? Or is it making it more sustainable? Or are you going to do more research and development and deepen the impact?
Sustainability.
Sustainability.
We in the United States have really a serious problem when it comes to our healthcare system. It's broken. And I am dedicated right now to really focusing on sustainability. Last week, I was in Washington, D.C., speaking with CMS, with senators and congressmen about the bills that are going to make major changes to provide patients the care they deserve. Right. And at the same time, creating an ecosystem that the payers and the providers are both winning. And that is the sustainability that we need to keep our healthcare alive in America. So I have made a dedication to myself that every single month I will be engaging with Washington, D.C.'s legislatures about the changes that we need to do in healthcare. And I have put together, working with other people, a small group that have that dedication. And I know some amazing things are going to happen.
It was a pleasure to speak to you.
My pleasure.
Very interesting conversation. I'm looking forward to more.
Absolutely.